Okay, so what it's like to be on a session with a psychiatrist? Well, then the answer is depending on what kind of psychiatrist you're choosing. If you're choosing the one that is pharmacological one, then you're gonna be in a 20-minute to 30-minute session. They're probably gonna, ask you to fill some details of your life, maybe in a checklist before you start, the session, or if not, they're going to ask you some, regular, just background and, illness, history and things like that. And then they're going to ask you some, very structured questions like, how do you sleep? What do you feel like? What's your problem? How is your family, connections and how many kids you have, if you have, or how are you living, what do you do, what do you work on, and that is the pharmacological one. If you are more into a holistic line, which is the line that I practice, then the sessions are going to be like an hour or maybe a bit more. At the same time, it's since it's more time, then you get to ask more about the patient, and you start to check about the personality that you have, like the professionals, like we already know, like once you start talking, what type of personality you have, because we studied a lot about personalities in university, so that is the reason why. And if you have some issues, then we're gonna start to detect what type of issues you have. If you're dealing with traumas, weird grief, or with the loss of somebody, if you're dealing with working, problems, or gender violence problems, if you're dealing with gender issues, and I'm specialized also in gender and LGBTI, well, communities. And so we're going to start to ask you some questions, and depending on what type of person you are, you can, just mm, go through the narrative, or if you're more like an inside person and it's hard for you to communicate, the problems, then we're gonna continue asking more questions in order for you to help us, get the information that we need, so we can figure out what's the treatment and what kind of plan that we're gonna have to offer you. Like maybe there is some medication that you're gonna be needing to use, maybe there's not, and we can just handle a therapy with a psychologist and with some other tools that we can teach you. It depends on the patient, so and it depends on the symptoms that you have and the basic personality and all the insights that you can go through, in the time that you get the session. The sessions are online, or they can be, in a therapeutic space, like, in like a general, office, doctor's office. It's not like psychology that some psychologists, if you're, like more Freudian, you can lay down and just talk about the things. Like psychiatrists, we just talk, sitting straight, in a regular position. And if you don't know what, your symptoms are, then we try to focus on, getting the information as much as you can try to express, because some people just cannot express what they're going through, and so we help them get into the line of finding the words to express what they're going through, or sometimes just telling, well, that this thing happened at my work, or this thing happened in my life. Then we figure out, most of the things that are going through, and some words, like, you don't need to find the words, like therapists will have the expertise. So in some kind of situations, like, we can find the words for you. So sometimes, we help the patient, like, so you're starting to feel like X, and maybe the patient says, oh yes, that's the thing that I was looking for, I didn't have the word to put it on. And that happens, sometimes it happens with men, that most, like, some men are very hard, that they find very hard, for them to put in words what they feel. And some women also may sometimes, but it usually comes with, men. There are some men that are very easy to connect with their emotions, and some others aren't. I have to assume, like, more than 50% or more of the patients are women. And the reason is not that because they are crazier, as society usually, jumps into that, concept. It's just because women are more into trying to find the emotional problems solutions. So they reach out, earlier, the mental system, than men. uh, Besides, having, some different statistics of, symptoms or personalities, or diseases and treatments, uh, men are, like, more retractive, and they find it hard to ask for help. So usually, like, if they do, that's great, and if you're the one that does it, then, congratulations, you're gonna get help, better, and faster in your life. If you're not, sometimes, the women around you or the people around you just try to, get you to get some help, which is like another type of, experience that we go through as a therapist. Like, maybe a man comes and says, well, somebody else of the family or partner or whatever, just insisted me on getting the help, and so here I am. And in the cases of the women, then women are most likely to just go and get help. And but that's the way, like, I mean, culture and gender differences handle in this, in our life. It's just, we're different, biologically, and culture, makes a big difference between, um the reason why asking for help for women is, like, easier, might be related to, the society just, approving women to get help. And it's just like, like, women can cry and men cannot. And it's kind of the society's, background that sometimes limits men to get help. And so when they get help, they get in a worse, like, scenario state, and they have worse symptoms. And that is the reason also why they get more, depression, very serious symptoms, or try to commit suicide more often, than women. Women ask for help before that they have those symptoms, or they try to commit suicide with less lethal, ways, so they have a less mortality. So don't be afraid, if you think that you're not in control of your emotions, or you think you're getting into a place that you feel like life's not worth living, and you don't have to think that there's no other way. There are many ways, and like, the major first thing you have to do is ask somebody that you know, or somebody that you trust, to help you to get in contact with the therapist. So, when you so when once you get into therapy, then there are gonna be some, like, there's gonna be a decision from us, from the psychiatrist, in order for you to get into, like, regular sessions weekly, or maybe twice every, month, or maybe once every month. And the best way is just to let the therapist decide, and if we recommend you to go into psychological therapy, which, most of the times would help, because it's another space that, helps the person get into inside the main issues that they're dealing with. So we're probably going to send you to a psychologist, which is not the same as a psychiatrist. Like, We don't replace each other. We work with each other. Like in my case, I work with other psychologists with my patients, the ones that have, psychological therapy, and we could communicate between each other so to know how the patient is going and what is the line of treatment that we're going to get through and the objectives. So it's not that you can replace, oh no, I'm going to a psychologist, so I don't need a psychiatrist, or the other way around as well. If you go to a psychiatrist, that doesn't mean that you don't need a psychologist. There are a few psychiatrists which do psychological therapy, and then the major psychiatrists, they would just send you to start a psychotherapy treatment and sessions. The psychology treatment usually is like once a week, and the psychiatrist might, see you once a month, or as I said, every 15 days, or maybe once every week. It depends on the symptoms and, the approach that, the psychiatrist is choosing for you to handle. There are patients that go to a psychiatrist and don't need medication, and they get along with the psychiatrist and they like it. They feel comfortable talking about their problems, so they continue to go to a space of treatment with a psychiatrist, and that happens. And so it's not that if you go to a psychiatrist, you're gonna have to, take some medication like 100%, because it's not like that. If you need medication, then there are types of psychiatrists that will give it to you for life, and then there are other types like myself that would handle